podcast with me, your host, Maria, where it is all about a strong body, calm mind, healing, and fully living. And today, our special guest is Dr. Karmy, who is joining us from Canada. Dr. Karmy is a medical director at the Pharma Clinic. He is an adjunct professor and a leading authority on pain management and regenerative medicine. And I'm super excited to talk to Dr. Karmy because I do think we have quite a few things in common in terms of how we approach the body and pain and so forth. But Dr. Karmy, before we get there, first of all, welcome.
Thank you.
Give us an opportunity to get to know you. Give us 3 words that tell us who is Dr. Karmy and a little bit of a backstory behind each word.
Okay. Well, I am, I guess, persistent. I am ambitious. I am, I guess, a long-term planner, although that's not quite a word.
That is fine. There are no rules around the word. So whatever words come to mind in terms of describing you, tell us a little bit of backstory behind those words. Like, how have those words showed up in your life, into who you are and what you do?
Well, I guess I was always interested at the intersection of biological research and business. Unlike, I think, some of your other guests that kind of looked at something and said, hey, I want to do this, there really wasn't any role models for that in Winnipeg, Manitoba, Canada, back in 1980s when I moved to Canada from former Soviet Union. There were definitely doctors. There were definitely people who did, basic biological research. There were business people who ran businesses, and at that point, it would typically be like a restaurant or, big business, like working for General Electric or something like that. But there really wasn't, I guess what I was really looking for is to start my own biotech company in a time before, really there was a biotech company.
Well,
there were 1 or 2, but really nothing that's, nothing that was big. This was long before they decoded DNA, before most of the technologies that now enable, doing things like creating vaccines against COVID, for example. So basically, I just kind of started moving in that general direction without necessarily really knowing the step-by-step path. And so, it was sort of logical to go into medicine, because if I'm, interested in biological research, that seems to be close enough of a field. And it gave you some things, like ability to run almost like a small business, unlike US, where physicians work for big corporation. In Canada, actually, you get to run your own shop. So it gave you a little bit of experience in business. It gave you some medical terminology. And then little by little, I started to move in the direction of research. I'm not anywhere near where I want to be, but, pieces are starting to fall into place.
Puzzle is starting to complete.
So I'm basically pursuing the same goal at 56 that I was pursuing when I was 20. Not quite there yet, but I haven't given up either. And, as much, obviously, I hope I get to where I'm going, but by the same token, I think it's important to do something that you believe in. This way, even if you don't reach your goals, you think that the attempt was worthwhile.
Yeah. And, I think that's when that Eastern European persistence pays off. You got into pain management kind of not very intentionally. You got into it and then you realized, oh, there is an opportunity out there. And now that is the focus of what you do. You are a family physician, right? That's your background.
Right.
What fascinates you about pain? I'll tell you, with what I do, and I'm not a physician. I do something very different. I work with people who are in pain, and I offer the movement piece of pain as well as the mindset that goes around with it. Mm-hmm. As a physician who specializes in pain, what fascinates you about pain?
Well, I mean, pain. Pain is very complex. Mm-hmm. And there's subgroups of patients with chronic pain responding to different types of approaches. There's probably no other field where the range of approaches used is as wide as it is in pain management. I mean, on the one side, there is, things that are very basic, like diet, meditation, exercise. And on the other extreme, there's very, very aggressive procedures like knee replacement surgery or even different forms of brain stimulation. We don't see it in most other fields. Like if you have a pneumonia, you put people on antibiotics. You don't start to wonder, should I put people on antibiotics or should I try them on acupuncture? It's just antibiotics. Whereas pain has so many different subgroups and so many different aspects to it, that often it takes a lot more trial and error, but also a certain level of logic to try to figure out what's the best approach for each patient.
Yeah. We see a lot of knee surgeries or knee replacements, hip replacements nowadays. I know you do a lot of stuff with osteoarthritis. Have you seen certain things that have worked prior to going into the surgery path?
To avoid surgery path, right? So, I mean, first of all, obviously, lifestyle is important, and weight in particular seems to have a huge impact on knee and hip osteoarthritis. These are the major weight-bearing joints. So there's all sorts of evidence that if you lose weight, it doesn't just reduce the pain in the joints, it actually slows down deterioration of the cartilage in the joints. There is some discussion about various forms of diet. Generally speaking, the kinds of diets that are healthy for other reasons, like Mediterranean diet is important for heart health. It also seems to help for osteoarthritis. When it comes to what medical doctors do, the big, I guess, shift in the last 20 years is that it used to be that the focus was mostly on pain reduction, where the joint continues to wear out, but if you reduce the pain coming from the joint, perhaps you can continue to function. And in the last 20 to 30 years, there's been an attempt to develop something that slows down wear and tear of the cartilage. And that's the different regenerative medicine approaches. There is some controversy whether or not they help. There is some controversy whether or not they actually help slow down degeneration or may hopefully even reverse degeneration and cause new cartilage to be formed. And I don't know that these questions are going to be solved anytime soon, because a lot of these approaches are not really being pushed by pharmaceutical companies, but rather these are approaches that were developed in the community. And so there isn't a single body with a lot of funding to do a big enough study to prove these things definitively one way or another. But there's certainly a lot of studies to show that regenerative medicine approaches can reduce pain. There's certainly a lot of studies to show that, smaller number of studies that can show that it helps regenerate cartilage in animals and perhaps even slows down cartilage regeneration in humans.
Slows down cartilage regeneration or degeneration?
It slows down degeneration of the cartilage.
What is your thought around? So I, for example, teach Pilates, which is a lot of core strength building, which the way I explain it to my clients is when your core is strong, you are lifting up the weight, rather you're sinking into your joints. So like you're not sinking into your hips, you're not sinking into your knees. And I do see great success with people who have knee pains, worn off cartridges, where they say, oh, wow, my knees don't hurt as much. I will tell you, a friend of mine, he was an ex-professional basketball player. He had terrible knees. He was in his probably mid-50s, and he was walking like, I don't know, a really old man because his knees were hurting so bad. And he tried all sorts of things. And I suggested to him, strengthen your core. And he was like, Maria, he's like, it's my knees that hurt. And I said, right, straighten your core and see what that's going to do for you. And he was amazed at the results. As a physician, and as pain is your specialty, have you seen results in your patients when they do specific core strengthening type of exercises that allow decompression of the different joints, as well as the spine?
Well, again, first of all, typically I give physical modalities is not something I personally do. I refer out to other practitioners for a lot of this sort of work. Certainly, just clinically, I find a lot of patients with, obviously everything is connected, right? So a lot of patients with knee problems will have a lot of spasm in the hip muscles, or muscles that control the hips. Obviously, in some ways, muscles that control the hips are also attached to the pelvis. So obviously in some ways no muscle functions in isolation.
Correct.
So if you change the gait, if you change how people redistribute their weight, it could very well help their pain. I find traditional physiotherapy clinics, they typically tend to focus more on quadricep muscles, but certainly it's not the only muscle that's involved in gait.
Yeah. I will tell you that one thing I personally see in my practice is that most people are they have very shortened hip flexors from all the sitting that we do. And then especially the psoas is shortened. and then that starts pulling onto their back, that starts compressing the hips. And then, it's the chicken or the egg. Is it the knee causing pain in the hip, and then that's causing the spine more problems, or vice versa? But when we can, again, elevate and strengthen everything, and a lot of these people, they might have weak quads, but they have tight quads, which weak and tight is not a good combination. And again, that's from my experience. And I think the other thing about Pilates is that it approaches the body multidimensionally. So we don't work just on the quads or just on a particular body part. We focus on the whole body and how it works synchronistically, because like you said, everything is connected.
Certainly when you walk, you're not just using a single muscle. It involves your back, your hips, and also the funny thing is doesn't happen very commonly, but some people with severe hip arthritis will not feel pain in their hip. They'll primarily feel pain in their knees. Mm-hmm. So something about the way that innervation happens in, I guess, fetuses, that these nerves must travel close together. So sometimes people will have hip pathology, but they actually feel it in their knee.
Mm-hmm. Yeah. What is your thought around the mindset around pain? Again, I will tell you, from what I see, people who are in pain are afraid to move. Mm-hmm. And one thing that you mentioned when we did the Authority magazine interview is you mentioned that when you have the pain, first you rest the area, but then after that you should start mobilizing the area. Mm-hmm. And it might be uncomfortable in the beginning, which is what I see. And mm-hmm. if somebody has experienced pain, when you ask them to do something, you see that bracing of like the fear of, oh my gosh, I'm going to move and something is going to hurt. Mm-hmm. And it takes a lot of, you have to be very gentle. You definitely have to work on the mindset of somebody who has gone through that and has that fear, if the pen dropped through the floor and now I have to bend down and pick up the pen and my back is going to hurt, or might not be able to straighten back up. What has been your observation as a physician with what you do? Because again, pain is what you do, and that's your specialty.
Fair enough. So again, pain is of course multidimensional, right? And so, we each bring a little piece, and nobody is an expert on everything. Orthopedic surgeon, they only do surgery, right? They won't do necessarily, for example, counseling sessions, CBT counseling, right? So everybody brings something a little bit different. Now, all of us are aware of the field. All of us are aware what other approaches may be useful. We don't necessarily offer those approaches personally, right? But yes, absolutely. I think, so for instance, what we do is we have various ways of making pain less severe, which is fine. We can do regenerative medicine treatments. We can do high-frequency nerve blocks, which is something that actually we only have in Canada. You guys don't use it. So any number of things. But what I find often with patients is if they just, do those sorts of passive modalities, yes, often they have less pain at rest. They're able to sleep better. Maybe their mood improves a little bit. But often it doesn't translate into functional improvement, because by the time at least they get to us, they had pain for years and years and years. They have a lot of muscle atrophy, muscle spasms. And as you said, they're trained to avoid things that, their body trained them to be very careful, to be very cautious. So, there's also a little bit of a peculiarity about pain as a sensation, in that, most sensations do not have a mood reaction to them. If there's a bright light, if there's a sound, if anything, after a period of time, your mind starts to tune out a lot of things, right? With chronic pain, first of all, your mind doesn't seem to be able to tune it out. which is maybe where some of us mind over matter approaches come in. And then the other thing is that unlike our sensation, it actually causes anxiety. It actually causes mood changes. It sometimes causes depression. So there is some kind of a connection between pain and mood, and we don't fully understand it. And certainly, if one can separate the sensation of pain from the anxiety that it creates, then patients tend to do better. Certainly, if people learn that they can, push, they're able to, that pain is not necessarily a signal that something is damaged and you should avoid using it, then they can do better. Again, not obviously going back to doing what they used to do before the pain started. It's often a slow and gradual process. But yeah, without physical activity, if you just use passive approaches, like, be it injections or lasers or whatever you do, for a lot of patients, yes, they have less pain, but it doesn't translate into them being able to do a lot of the things that they want to be doing.
You bring up so many important points to personally things that I have observed and then I see. And one very important point is that I see people who are in pain, they don't have the same quality of life, right? Because they cannot go hang out or go on a hike or go hang out with their friends or play with their grandkids or whatever it is that is interested to them. And then in some instances, it results, you mentioned depression, because I think a lot of times when people are in pain, they become isolated. Because again, they cannot sustain the same activities that they enjoy to do. And then it kind of becomes a vicious cycle. I'm really glad that you brought up the importance of physical activity and strengthening, because I think with what I do, a lot of times there are alignment issues and there are compensations that have resulted because of the pain, right? So if your one side of the hip hurts, you're going to shift the weight onto the other hip. That's going to make you crooked. And over time, you're going to start wearing and tearing everything so much faster. So I definitely think that physical movement, the physical activity effect is, with what I do, I'm slightly subjective. I think it's very important for people. And you mentioned one more thing, and now I'm blanking out on it, but I loved everything that you said. And I think it's so important. You also said pain is multidimensional. I think it is very important to address pain multidimensionally. And I will tell you, one of my favorite things to do is to see somebody who is in pain and kind of isolated, and like their desire for life, I want to say, is not there, to start seeing how they're stronger and now they want to hang out and they want to go and do things, and like their vibrancy and their energy changes completely. And I'm sure you probably experience some of that too, because that's what you deal with, but it's very exhilarating for me.
Yeah, in terms of social isolation, families can either make things better or they can make things a lot worse. And there's basically two extremes. There's the extreme where they completely dismiss their pain and think that people are, their family member just exaggerates or is lazy. And so there's that sort of extremes where often it's not productive. Although people can improve over time, usually chronic pain is chronic for a reason. They can't turn on a dime and start doing what they used to do, in a week or two, right? Often it's because almost everyone experienced acute pain, like a sprained ankle, and it's gone in a week or two. So when they see somebody and their pain is there a year later, and they haven't broken anything even, so there is a group that essentially say, oh, you're just not trying hard enough, you're just lazy. And that will often be very unhelpful, let's just say, to the patient. Then there's the other extreme. And the other extreme is people who decide, oh, this person is totally disabled by their pain, and say, don't lift this, don't do this, don't do that, where, a person almost develops learned helplessness because everybody around them tells them not to do anything. And, I find, the sweet spot is kind of in the middle, where you kind of accept where they are right now, but don't assume that's destiny. Don't assume this is what it's going to be for the rest of their lives, and try to encourage them to do as much as possible for themselves. That's, I find, and of course, as I said, having family is very important for especially chronic pain patients, a supportive type of family, because they're often, isolated from their friends. They're often isolated from, often they don't work, so they don't have any socialization at work. So, I think, at least in my experience, family can make a huge difference, assuming it's the right kind of interaction.
I would expand that to say it doesn't have to be family. It could be friends. It could be community. I call it the tribe, but people who just support you into whichever way, whether it's to be pushed a little bit, or, maybe it's to be pushed to do something about your pain. And to support you through your growth journey. Because I will tell you, one thing that I see is people who are in pain, they come scared to move. They don't want to move. They're like small movement. You can just see the tension into their body. They start feeling better. And something that you said is it's a gradual process, right? But they start feeling better, and all of a sudden they throw themselves back into an old activity. And very frequently I see people re-injure themselves because they start resuming activity before they're ready for it. And that can be very discouraging for people. But one thing I tell people is that you don't have to live in pain. And there are many modalities. A lot of the things that you do regenerative medicine. Some of the things that I do. What is the one advice you tell to people who are in pain, Dr. Karmy?
Well, one.
Sure, go multiple ones.
I think what I usually tell patients is, people always ask me, what's the best treatment for pain? Because guess what? They want the best one, right? And then the other question that comes up all the time is, when is my pain going to be gone, right? In the first one, I usually try, because we are subpopulations of patients, there isn't a single treatment that helps everybody equally well. If I take somebody and put them on, say, gabapentin, a tablet that is sometimes used for pain, about 1 in 5 patients will respond, and the other 4 will find it totally useless, maybe even get side effects from the medication, right? And my experience has been that if you look at almost any treatment for chronic pain, and I've been doing this for over 20 years, the response rate is anywhere from 30% to 70%, okay?
We're talking about
Now, there are some general ideas, like the fact that exercise is important, the fact that, if you don't have the right kind of mindset, it will hold you back. But after that, but even there, like, some people will find cognitive behavioral therapy works better. So as opposed to somebody else finds mindfulness therapy works better, right? Some people find yoga works better. Some people find Pilates works better, right? There isn't like a silver bullet. So what I usually tell patients is, first of all, expect trial and error. There isn't one treatment that's best that helps everybody. So it's more about, it's a little bit like marriage. It's not so much about finding the best partner in the world. You want to find a partner that's a good fit for you. They may be horrible fit for someone else, but they're a good fit for you. So it's the same thing with approaches to pain management. You got to be patient. You have to understand it's going to take a while, and you have to be willing to experiment. I know people say, well, I don't want to be a guinea pig, but there's no shortcut. There's no way around it. There's no MRI that you can do and predict who is going to respond to which approach. And in terms of when the pain is going to be gone, I usually tell patients that it's probably the wrong question, or whether it's going to be gone. It's probably the wrong question to ask. Generally speaking, if the pain is chronic, it's going to last for years. Now, it could be 1 year, it could be 2 years, it can be 10 years, it can be 20 years. But there's no way to know. So what you focus more is the direction. As long as you're finding that every month is better than the month before, then you continue with what you're doing, and hopefully it's just a question of time before the pain improves a lot or maybe even goes away. If, on the other hand, now pain never, by the way, is stable. Everybody's pain does this. It fluctuates up and down, depending on weather, stress, physical activity, a million different things. So, but what you should be seeing is month-to-month progress, where every month, maybe you don't have as many bad days. Every month, you're able to stand a little longer, sit a little longer, sleep a little better. If you're finding that sort of a progress, then you're on the right track. As I said, hopefully it's just a question of time, and I wouldn't get too worried about when the pain is going to be gone. Also, job comes up a lot. And what I'll usually tell patients is, a lot of patients will stop doing everything, stop working, stop doing everything until they're totally cured.
Yeah.
And because we can't predict when it's going to happen, we can't even for sure predict if it's going to happen. I usually advise patients to assume the worst case scenario, assume this is as good as you're going to get, even though obviously we hope to get them a lot better, and start to ask themselves, what can you do with the limitations you've got right now? Most people, if they think hard, they will be able to find something, especially if they used to do very physical jobs like, trades, laborers, those sorts of people, right? Often chronic pain patients need more flexible jobs. Often they need jobs that are less physically demanding. Anyway, that's probably more than what you asked for.
No, that's good. I think one of the very important points you made is that you have to be patient with pain, because the same thing, people come to me and they're like, how long till I'm out of pain? I'm like, I don't know. I don't know your body. I don't know even if your body is going to like the type of movement that I'm giving you, right? I've had great success rate, but I tell people Pilates is not the right solution for everybody. So to your point about trial and error, it does require patience and it can get discouraging. And I think it's important to know that there's so many modalities. You have to find the right that works for you.
Also, I find with exercise, it takes a little bit longer in general than pain reduction modalities. Pain reduction modalities, depending on which one you use and how you use it, but generally speaking, let's say physiotherapy, within 2 months, I would say even within 5 to 6 visits, you should know if a specific approach is helpful. But obviously, muscles take longer to build up, changes in flexibility take longer to accomplish. So, like, how long would it
take
be before you have a sense?
People, I'm not a magician, I would love to help you, but I don't do magic. It's your body. And the other thing I tell people is we have to meet your body where it is. So some people, they start being healthy and strong and flexible, and some people don't. And your body knows the difference, right? Your body knows if you've been doing exercise before you got injured or before the pain. It knows, if you're eating well, sleeping well, like all of those things, your stress levels, they contribute to the pain or help the pain. So
my sense is it probably takes, I guess maybe I'm wrong, my sense is with exercise program, it takes a good 6 months before you're going to have a good sense if it looks promising.
And that's what I ask
pain
people.
treatments, you can figure it out much faster.
That's what I ask people. Give me 6 months, and to your point is, how are you doing after each session? Is it better or is it worse? And I tell people, if you have muscles which have not worked for a long time, they may not be so happy after you start working them, right? But over time, are you seeing the progress? I mean, I will tell you, I've had clients who have gotten off pain medications and they know they need to move. We have increased flexibility in the spine. It has taken weight off their joints, and it's amazing. But you have to be patient with it. And we want an overnight fix. Dr. Karmy, this is such a fascinating conversation. I'd love to stay in touch and just pick on your brain, because it's fascinating what you do. But for the sake of wrapping up, tell people where they can find you. What is your social media channels, website? You're in Canada.
Right. We're just getting started with our social presence. We've been around for 20 years, so we haven't really needed to, how shall I say, promote ourselves. We do have a website, karmyclinic.com. And then there's, frequently asked questions. There's some of the treatments that we do. For, I guess, Canadians, we offer stem cell injections. We're one of only 2 clinics in Canada to offer that for osteoarthritis. As I said, what might be interesting for US listeners, there's actually a whole new form of pain management called high-frequency nerve blocks that only exists in Ontario, that does not exist in US, that probably treats about 55,000 patients a year in Ontario.
Okay. Well, I appreciate your time, Dr. Karmy. Thank you so much for your insight and educational information. Rebels, you know the drill. If you have any questions, certainly feel free to ask those. Dr. Karmy, thank you for being here with us today. And Rebels, please make sure that you stay rebellious. We'll see you next time. Can't get enough of those rebellious conversations? Do make sure you subscribe, like, and share with your friends.